Hello everyone, I'm Dr. Lim from KB Lim Skin Clinic. Today I'm going to talk to you about tranexamic acid, a novel agent in the treatment of melasma, also known as chloasma. Melasma is a common cause of pigmentation in women. It is most common in pregnancy, hence also known as the mask of pregnancy. It is more common in individuals with skin phototypes 4 to 6, which includes Asians, Hispanics, Latinos, and Africans. This patient has melasma affecting the cheeks, the nose, and to a milder degree, the upper lip as well. This patient has melasma affecting the cheeks, especially over the prominence. Treatment modalities used in melasma include the following. One works by increasing skin cell turnover. Basically what this means is they work like peeling agents so that the top layer of the skin which is older and has accumulated more pigment is peeled away, revealing the younger skin cells which have accumulated less pigment, so the skin looks lighter. Another treatment modality is the use of lasers and light machines that target the pigment that has already been formed. So the first and the second treatment modalities all remove old pigment. Lightening agents highlighted in yellow works in a different way because they reduce the production of pigment. So this works at a much earlier level, and it is a better way of achieving lightening because it reduces the production of pigment in the first place. So the lightening agents that have been used work in the following ways. One is they directly or indirectly inhibit tyrosinase, the enzyme that's involved in pigment formation, or they interfere with the transfer of pigment from the melanocytes to the surrounding keratinocytes, which are the skin cells. Below is a list. It's not an exhaustive list, but you can see the first item highlighted in capital letters and in green is hydroquinone. This is the most effective lightening agent available to date. Now the last item, tranexamic acid, which is also referred to as TA, works in a different way, and I'll talk about that in a short while. So again, in the epidermis, you find melanocytes. They reside at the basal layer of the skin. This is where the skin cells are produced. So as skin cells are produced, the melanocyte actually produces melanin and packages them into structures known as melanosomes, and they inject the melanosomes into the newly formed keratinocytes or skin cells. And it does this in a very uniform manner, and it provides the skin with a natural even color that gives our skin its appearance. Now on the left hand side you can see the melanogenesis pathway, the production of melanin. You'll notice that there's an enzyme in the yellow box called the tyrosinase enzyme, and its substrate includes tyrosine and L-DOPA. It converts those two chemicals to L-dopaquinone, which is converted to melanin. Just focus on the structure of tyrosine and L-DOPA, which is quite similar, except for a slightly different branch chain. And here you can see a third item, which is the lightening agent hydroquinone. As mentioned earlier, this is currently still the most effective lightening agent. And the way it works is you have tyrosinase enzyme, which can bind to all three of these chemicals because their structures are so similar. When tyrosinase binds to hydroquinone, nothing happens, no pigment is produced. So when we use hydroquinone on the skin, it takes up some of the tyrosinase, so less tyrosinase enzyme is available to bind to tyrosine and L-DOPA, which leads to the formation ultimately of melanin or the skin pigment. So hydroquinone, as mentioned, is the most effective treatment available, chemical available, lightening chemical available, and it is most effective when it's combined with tretinoin, which is also known by its brand name Retin A, or a steroid. And they are used, these three items together are used in what's known as Klickmann's formula, and because it contains these three items, it's sometimes also called the triple combination cream. It is very effective. The reason why it's effective is, one, hydroquinone inhibits tyrosinase, the enzyme that produces melanin. And tretinoin works by increasing epidermal skin cell turnover as well as dermal turnover. The cell turnover is increased, so it produces better looking, stronger epidermis and skin, and a better looking skin. Steroid is the third item in Klickmann's formula, in the triple formula cream, combination cream. It has an anti-metabolic effect. That means it slows everything down, including the formation of pigment, the activity of melanocytes, and it also reduces the formation of skin cells. So if it does so, it's going to cause thinning of the skin, and that is exactly the side effect of steroids when it's used for a very long time on the skin. The other advantage of adding steroid into the formula is it has an effect on reducing pigment formation, plus it also reduces irritation or inflammation, which is sometimes caused by tretinoin and hydroquinone. So, Klickmann's formula is very effective. It contains three items. It's also known as the triple combination cream, but it has its downside. One is atrophy or thinning because it contains a steroid. Two is it contains hydroquinone, which although effective, some patients can develop an allergy or hypersensitivity to it. And likewise, tretinoin or retin A can also cause irritation in some skin types. And so these are the three problems with the triple combination cream. Because of the risk of thinning of the skin, it's recommended that the treatment should be short, not more than 2 months. But unfortunately, a lot of patients find this treatment very effective, and they are reluctant to stop treatment because as soon as stop, the melasma gets worse. What I do is I do the next best thing. You can't stop everything. I remove the steroid from the triple combination, so it becomes what I call a double combination cream. And this works quite well as long as patients are not irritated by hydroquinone or retin A, tretinoin. It doesn't cause thinning of the skin. Now, patients who get irritation may show as redness as seen in this slide, very similar to rosacea, which this patient happens to have. Now, the other problem is thinning of the skin. When the skin is thin, it causes it makes the skin appear very red and blotchy, and that's caused by dilated capillaries in the skin, which show through the thin epidermis as a result of atrophy or thinning of the skin due to steroids. Now, this patient has acne rosacea. Now, steroids can also cause rosacea, and we call this steroid rosacea. And rosacea looks like this. It causes red pimply bumps as well as pus heads on a background of erythema or redness. So this patient has rosacea. Now, the other problem that we see in patients with melasma is some of them develop rosacea-like flushing of the skin. This patient has rosacea and flushing, and the skin can look intensely red, and that can be very disconcerting to patients. And it produces a warm sort of burning sensation which patients do not like. So, some patients with melasma develop redness. So we have to understand what are some of the causes and eliminate them. One is rosacea, as mentioned earlier. Patients with melasma can have rosacea, or patients with melasma who are using creams that contain steroid, like the triple combinations cream, can develop rosacea. Some patients with melasma and redness may have underlying eczema which needs to be treated. As mentioned, steroid overuse for various reasons, either for treatment of eczema or treatment of melasma and the triple combination cream, can be caused by steroids, because steroid causes thinning of the skin and it makes the skin look red. The other cause of redness is of course allergy or hypersensitivity to hydroquinone or tretinoin. So these have to be eliminated. So generally for me, patients with melasma and redness, I avoid using hydroquinone, tretinoin, or peeling agents for that matter, and topical steroids. We can use another treatment which I will talk about shortly, because it works in a different way. So, as mentioned earlier, we mentioned about lightening agents and the way it works. Now, there is a third way that lightening agents can work, and that is by blocking VEGFs. VEGFs stands for Vascular Endothelial Growth Factors. And one of the chemicals that can do this is tranexamic acid, which is the topic of our discussion for today. Tranexamic acid is also known as TA. Tranexamic acid was first used in the form of tablets by Dr. Sadako in 1979 for the treatment of melasma. He reported it to be helpful in lightening melasma. It is not a new drug because it's been available since 1968 for treating women with heavy periods or menorrhagia, and it has also been used to prevent bleeding in patients who are undergoing surgery. So the way it works is it makes the blood thicker and more so that it clots more easily. Now the downside of this is, and this is why tranexamic acid must be used under strict medical supervision, is because it increases the risk of clotting, which may not be a good thing because the clot can embolize or can be transmitted to other parts of the body in the blood and cause thromboembolic events such as thrombosis in the deep veins of the legs, embolism in the lung, or strokes. So tranexamic acid, as mentioned earlier, was first used by Dr. Sadako in 1979, but as an oral tablet. Now, we mentioned about the clotting side effect, possibility of clots, which is why topical tranexamic acid is a good alternative, because some patients may have risks that we mentioned earlier on, a history of thrombosis, or some they're on oral contraceptive pills, because that also increases the risk of thrombosis. We do not want to use oral tranexamic acid. So topical tranexamic acid is an alternative. Now topical tranexamic acid, unlike hydroquinone and retin A, is very gentle on skin. It rarely causes irritation or hypersensitivity. In fact, I've not seen a single case in my practice, in my experience, causing irritation to the skin. So what I do with patients with severe melasma is I might start them on oral tranexamic acid, and then after about 2 months I switch them to topical tranexamic acid, which is suitable for long-term use and without the risk of clotting, which can occur in patients taking tranexamic acid by mouth. Now, patients who might want to consider tranexamic acid are those patients who have melasma and have telangiectasia, those broken capillaries, or the skin is always red or flushes every time they move from a cold to a warm environment. Patients who have ochronosis, which produces a very gray-blue discoloration from use of impure hydroquinone or high concentrations of hydroquinone, and some patients who develop confetti-like loss of pigmentation of the skin from melasma, and because from hydroquinone. And because many patients have heard about the potential side effects of hydroquinone, there is a group of patients who will not hear of hydroquinone. They are very averse to using it, and tranexamic acid would be a very good alternative for this patient. Now, I have a separate video on melasma, as well as some articles on melasma, and I will provide the links in the description below. So I hope you found this presentation useful. Tranexamic acid is a novel agent. It can be considered in patients who have irritation from some of the lightening treatments, and as mentioned, application of tranexamic acid is very safe and can be used long term. Note that melasma is a chronic problem. You can lighten it, but soon as you stop the treatment, melasma will come back, and we have to mention that avoidance of sunlight is very important, because sunlight makes melasma worse, and this is something that we always remind our patients: avoid the sun and to use sunblock consistently. So I hope you found this presentation useful. Please visit our website at www.kbilinskinclinic.com, where you can read more articles about skin conditions